Class 4, we review some general information about ASHA's Code of Ethics and discuss Principle 1. In the next class, I'll be talking about Principles 2, 3, and 4. In the annotated Code of Ethics I wrote for this class, I tried to provide examples of illustrations of each rule of ethics. Now, at the beginning of your career, it's more difficult to appreciate all of the work situations which arise in professional practice. In the past, it's not been until our second-year grad students start externships that they will seem to be exposed to and recognize more instances of ethical concerns. We try not to show you the dark side of speech pathology here in our clinic. The ASHA Code of Ethics is considered the Bible of professional behavior and conduct for speech-language pathologists. In the preamble or introduction to the Code of Ethics, it describes the code as the moral basis of the profession. The preamble also specifies whose behaviors are governed under the code. Like the Bible, the code only presents general guidelines to be applied to situations rather than attempting to cover every specific situation that might occur. Thus, the code intends to convey the general principles and concepts inherent in good practice so that SLPs can share a common set of values in their work, and so each of the thousands of members of the profession might be perceived as being trustworthy and reputable. It's also important to develop a good understanding of the structure of the code, because that will help guide you to finding the rule most appropriate to the specific scenario you are studying. I don't expect you to memorize the Code of Ethics. You will be able to use a copy of the code on exams for this class. However, you will not want to spend valuable test time trying to decipher the code and trying to find the specific rules within it. Hopefully, your studying will result in understanding the code well enough to know where to look and how to analyze situations and sample case studies for the final exam. A first step is to recognize that the code is segmented into 4 categories or principles: promoting the welfare of the client, maintaining professional competencies, our responsibility to the public, and our relationship with other colleagues and professions. From there, we'll look at the rules which define and explain and clarify each principle. Let's look first at Principle 1, promoting the client's welfare. Putting the patient's interest first above all else. Perhaps the best way I can relate this to you is through a life experience the majority of you have not yet had, having children. While I'm sure you can understand the concept of putting your future child's interest before your own, it's nearly impossible to describe the inner passion and personal responsibility you feel in protecting your child. Like a mother who lifts up a car to free her child trapped under the wheels. Perhaps the best word that I can think of to express that feeling to you would be heroic. You will instinctively be ready and willing to do things anyone would see as being brave and heroic to protect your child. You won't need to think about it because you'll just know it's the right thing to do and do it. Anything. Just wait, you'll see. Now, we really can't expect that kind of passion in protecting your client and his interests. But similar thoughts of treating them with dignity, respect, and working diligently in their best interest is the point that I'm trying to make. If you can demonstrate that what you've done places your client or subject interest above all others, you will have placed yourself in a very good position to defend the ethics of your actions. Perhaps one reflection of the relative importance of Principle 1 is that it has the most rules, 15. But it's not the number of rules that's important, it's the diversity of situations and behaviors that relate to the treatment of clients and research subjects. In effect, the rules of Principle 1 serve to detail common ways in which promoting the client's welfare are demonstrated. They include doing what you do competently, using every resource at your disposal to provide what's best for the client. Not discriminating against clients of a protected class. Accurately identifying and representing support personnel. Appropriately delegating professional duties. Fully informing patients and subjects of possible effects of services and research activities. Evaluating the effectiveness of your work to ensure it benefits the client or subject. Not guaranteeing outcomes. Not providing service only by correspondence. Using telecommunications appropriately in the provision of services. Maintaining and securing records of services and research. Maintaining confidentiality. Only charging for services provided and representing activities fairly. Informing and obtaining consent of clients and subjects. And finally, ensuring that a provider's health and related capabilities do not adversely affect their practice. In guiding your professional practice under Principle 1, you might consider acting under the Golden Rule. That is to say, treat your patient or research subject in a way you would want to be treated, or your parent, sibling, or loved one to be treated. Doing your best to hold paramount the welfare of those we serve. That's Principle 1. We'll look next at the other 3 principles and rules of ethics in the next class. Remember, ethical behavior stems naturally from ethical thinking. See you in class.